What's up, guys? My name is Ali Ahmad. Welcome to MSK Mondays with Ali, and today we're going to tackle a practice question using the typical PT mock exams and practice question website. Let's get to it. So we'll go on to the question bank, go on to musculoskeletal. Let's do a practice, make it quick and short. Said musculoskeletal. Let's do an intervention. We'll go a medium difficulty. So for this question, 4 months ago, Daniel, 55-year-old, he underwent a total hip replacement. He started weight bearing 3 weeks ago after the surgery. Right now he's got occasional pain in his right leg. He can weight bear with no support. And on the exam, we see from the manual muscle testing on his right leg, we got hip flexors 3 out of 5, hip adductors 4- out of 5, hip extensors 3+ out of 5, and his patellar tendon reflex, it's graded as a 2. So based on the findings, which movement should be avoided so we don't place load on the hip joint? I'll give you guys a few seconds, or you can pause video real quick to read through the answers and make your choices out of any one of these 4. So for my answer, I'm going to go with C. He can't internally rotate a deduct or perform flexion beyond 90 degrees. All right, looks like that's correct. So there's 2 types of hip replacements. There's an anterior hip replacement and a posterior hip replacement. And the precautions for both are going to be opposites, in fact. But with an anterior hip replacement, the precautions are you can't do hip extension, hip external rotation, and hip abduction. With a posterior hip replacement, you can't do hip flexion, hip adduction, and you can't do hip internal rotation. Now, this is important because if we look at the case Daniel, and it sounds like he had a posterior hip replacement, we can see that he has stronger hip extension than hip flexion, meaning he has more of an extended hip than he does a hip flex position at times. Now, if that's so, then you ask yourself, okay, then he has stronger hip extension. So based on the precautions of the following hip replacements, which one would it make more sense for him to be more of in? Well, he has weaker hip flexion, which means he's probably not doing as much hip flexion. And if he's not doing as much hip flexion, that means he's probably not doing as much internal rotation and adduction on the hip, meaning that he's doing a posterior hip replacement. So the answers, and so they're going to be that you want to avoid hip flexion, hip internal rotation, and hip adduction. For the hip flexion component, generally 45 degrees is okay. You just don't want it to be past 90 degrees. That's the real cutoff.